So MS is a disease in which your immune system begins to attack your brain and your spinal cord. It tends to occur relatively early in life, with most people affected in their 20s and 30s, with episodes that occur throughout that time, which may be weakness on one side of their body, it may be vision loss, it may be imbalance, it may be changes in sensation. And these are episodes that last about a week or two, and then they subside, and usually the patient will go back to normal. Sometimes they don't. Sometimes they're left with some, deficit. It's a common autoimmune disorder, so it's because the immune system is attacking the brain and spinal cord. We have to try to control the immune system in order to control the disease. All the medicines available are focused on causing some modification to how your immune system works. The drugs work really well. It's a very treatable disease where, 30, 40 years ago, patients who were, diagnosed with MS usually had pretty bad news because there wasn't really effective treatment, and most wound up paralyzed and very disabled. Nowadays, people live very normal lives, and women have kids, and they live very normal lives. There are still some outliers where people have more severe disease where it's a little harder to manage, but overall it's a much more manageable disease these days. There's no cure. There may be a slight predisposition for women to have the disease, and it presents a little differently. Women tend to have the relapsing form, so the form that gives you have these episodes. They will have it more early in life. Disposition for men tends to be a little bit later in life in many cases, but that's not an absolute. There may be more of what we call primary progressive multiple sclerosis, which you develop a certain set of symptoms and they just kind of get worse over time. While there is no cure, we do have very effective treatments to minimize these relapses and even now slow the progression that may come later. The episodes that come on suddenly or relatively suddenly, we treat with steroids, so that quickly stops any inflammation and kind of shuts down the immune system quickly. But the medicines that we use longer term help prevent those episodes from occurring. Or help slow progression of disease over time.